All right, let's talk COVID-19 now. Hospitalizations appear to be holding at its highest point in the sixth wave, with over 1,700 patients admitted across the province. Now, all of this is coming as officials are also investigating severe liver disease in kids with an unknown origin. For more, I'm joined by infectious disease expert Dr. Isaac Bogoch, welcoming him back to BT. Good morning to you, Dr. Bogoch.
Hey, good morning.
All right, so let's begin here. Severe acute hepatitis, and I know a lot of people are trying to connect the dots. What are the cases? Is there a linkage to the pandemic at all? I want to get your take on all of this.
Yeah, this is still pretty early on in all the investigations. And, I think what's clear is there are a growing number of cases of this. It's still extremely rare. We're seeing cases pop up in multiple countries. It's in younger children. Now, based on the investigations to date, it's still not clear what this could be. When you're doing an investigation, it's extremely important to keep an open mind, not prematurely rule anything in, not prematurely rule anything out. Yes, of course, you can't ignore that we are in the midst of a massive pandemic and there's a lot of COVID around there. And of course, sure, it absolutely might be a COVID related illness or what sometimes was called a post-infectious inflammatory syndrome. That might be it. But again, you don't want to have what's called an anchoring bias and just say it's COVID and ignore something else, because there are also other viruses and other non-infectious etiologies that could be doing this. This will take a few weeks, but we will get an answer in good time.
We are following the news here of Moderna applying for emergency authorization for their vaccine for those under the age of 5. Your thoughts on this, but also what this could mean for Canada?
Yeah, certainly when we look at who's getting infected and who gets sick with COVID, obviously anyone can get infected of any age, and the risk of severe infection is really highest in the oldest age groups, the 60, 70, and 80-year-olds. But if you take a step back, there's also a little spike in younger individuals as well, especially those under the age of 5 that can't be vaccinated yet because they're not eligible. A vaccine would certainly be welcome in this age cohort. Of course, you want to make sure that it is safe. You've got to have all the right safety signals and effectiveness signals before it's given the green light. And like anything else, show us the data. We want transparent data, good quality data before it's given the green light for this age cohort. You got to be careful in every age cohort, but we're talking about kids under the age of 5. Of course, you've got to be careful as well there.
Yeah, Dr. Bogoch, I think I've asked you this question several times over the course of the last couple years, and everyone wants to know when this pandemic will be over. We heard some interesting words from Dr. Anthony Fauci in the U.S. about where we are, at least stage-wise, in the pandemic. Where do you believe we are?
Clearly we're in a much better place right now than where we were, a year and 2 years ago. We have vaccines, we have therapeutics. We're in the midst of a wave, and it's a nasty wave. But remember, as you pointed out earlier, our hospitalizations. Of course, we don't want anyone to get infected. We don't want anyone to land in hospital or anyone to succumb to this illness. But our hospitalization rate's around 1,700. It might go up a little bit, but this is in the context of having virtually no public health mitigation efforts in place, right? We're not mandatory masking. There's no capacity limits or anything like that. And if we were doing this, with a different variant at a different time in the pre-vaccine era, I think sadly we would have been getting throttled. I'm not diminishing how significant this is. This is still a nasty infection, and we should do everything we can to protect ourselves and those around us. We absolutely should. Having said that, we're clearly working our way through the pandemic phase into an endemic phase. One last point, though, even when we are in what we would call an endemic phase, the virus is still here, and the virus is still going to disproportionately impact at-risk individuals, at-risk communities, and it's still going to cause problems. So it's one of those things where you can't ignore it. You can't put your head in the sand and pretend the problem doesn't exist. We still have to continue to use a science-based and practical approach, acknowledge that this is here, create safer indoor spaces so that every Canadian is safe.
Dr. Isaac Bogoch, always appreciate your time. Thank you.
My pleasure.
Be well.